Hey guys, Dr. Sharma here. As you know, recently I cruised through medical school and landed residency. Well, I wouldn't necessarily say I cruised through medical school because I would definitely say it wasn't exactly easy. And to be honest, it was actually pretty difficult because you're spending a lot of time learning a ton of information under a very pressured environment and trying to prove to yourself that you can learn medicine adequately. So a lot of my time those last 4 years was spent hunkering down and concentrating by myself, just learning a lot of information. And not only was it a lot of time to just be studying, but it was also a lot of time to actually sit down and think about the decision that I made to even go into medical school in the first place. Which is part of the reason why I'm making this video, is to talk about my decision of even going into medical school and if I would even do it all over again. Now, I kind of wish I'd watched or talked to somebody who had been through medical school and asked them these sorts of types of questions, because it would have given me at least a little bit of an insight as to how things were feeling even after they had graduated medical school, and not only during it. Having that opinion may not sway your decision entirely, but at least gives you an idea of how people are feeling when they're going through it. And I would say there's multiple factors that go into my decision of whether I would have gone into medical school again, because you see a lot of people who go into graduate school or higher education have to take out medical school loans and take on student debt in order to attend these schools. And a lot of the time it may not be an ideal salary coming right out of graduate school. The average resident salary coming out of medical school is about $56,000. You may be a couple thousand above that or below that depending on where you go, what city you live in, and the geographical location. In a survey sent out by Medscape in 2018 about resident compensation satisfaction results, about 50% were satisfied with their first resident year's salary. Okay, just to start off with, about half the people felt fairly compensated with their income, which I would say may feel relatively low depending on how much they're working, especially given the specialty that they may have gone into. And that's only the first year of residency. And during that first year, you're finally getting to use a lot of your knowledge and put it into action and start to really stretch those skills that you were working so hard learning during those first 4 years of medical school. However, down the road, as the compensation results start to ask about PGY 2s and 3s, about how they felt, how they were compensated, and if they felt like it was fair, you will start to see that the percentages start to go down below 50%. Now, I mean, imagine being a PGY 3 or PGY 4 surgical resident, making those really big life-changing decisions for a patient, and running an entire OR or surgical team, getting paid a significantly lower amount than what you would be even in just the next 2 years after you have a real paying job as an attending. Now, of course, a lot of factors play into that, such as the amount of experience, graduating from the residency and having done well according to your PD and the other attendings. But I can imagine being a PGY 3 or PGY 4 being fully satisfied with that salary that's only going up by a couple thousand each year. And to begin with, it probably started around mid 50,000s. Now, of course, fast forward to becoming an attending and graduating from residency, you get a huge compensation increase, but by that time you might be 31 to 35 years old. And well, from a lot of my friends and talking to people, and the overall opinion is to say that sometimes it might be a little bit more fun when you have at least a little bit of better compensation, younger when you get to have a little bit more fun. But hey, to each their own about that opinion, right? Essentially, it is just a big delay in gratification. Another huge reason why residents feel a little bit undercompensated and not as satisfied is because of a large amount of work, paperwork, electronic medical record documentation that they have to do for each and every patient that they see in an adequate amount of time. You see, in residency, this may take out a large percentage of your day and it takes away a lot of time from actually seeing patients physically and having conversations with them. In the last decade, this has been a huge problem because a lot of the time spent during the day at work is going to be typing notes, especially depending on what specialty you do. And well, even in my own opinion, I'd really imagined being able to talk to my patients for longer, having longer conversations with them, talking about their concerns. But instead, it kind of felt like I had to do a lot of the bureaucratic tasks and get my work done in an adequate amount of time in order for me to actually see all of my patients and not leave work super late. Now, of course, this facet of medicine will of course change depending on what specialty you end up going into, some requiring a little bit more of documentation work than others. But I think that each specialty in their own way may have some of those tasks that is sort of a barrier between you and your patient. Another factor that plays into my decision of choosing whether or not I would have done medicine again is the amount of respect, or lack thereof, that you get or don't get until you become an actual attending. Now, a lot of residents and attendings will respect medical students' opinions more than others, but really until you become a resident or a full-fledged attending, it really feels like your opinion is not as important, and a lot of people as medical students feel as though their opinion really doesn't matter. It's kind of like you're just hunkering down, staying under the radar, learning your stuff until you can actually use that information later on and actually make an important decision. Sometimes you will feel like you're kind of a fly on the wall and you're kind of on the sidelines, not being able to make those big decisions that the residents or the attendings will be able to do. Once in a while, you're going to get those moments where you'll actually be able to input your decision on a rotation. And those moments are great, especially if you get them right, because it feels like you're playing a role in the patient's care, and the entire team will really appreciate that. I felt as though sometimes those moments were very rare because a lot of the time in the hospital, people are trying to get things done. They're trying to get the ball rolling, get the patient dispositioned and discharged, and get the paperwork done, that sometimes they really don't have that much time to have a medical student's opinion or input on a patient's care. That's kind of the unfortunate truth about medicine and working in a hospital, a reality that you're going to have to face if you end up deciding to go into medical school. Another big factor, and the final factor that I'm going to talk about that plays into the decision of whether or not I would have done medical school again, is keeping those side hobbies and those things that keep you happy during those 4 years and being able to really exercise those while you're in graduate school. And by that I mean is still being able to have fun and do your hobbies such as art or hiking or going to the gym, whatever it is that makes you super happy, being able to keep that hobby on the side so that there's some meaning to your life outside of medicine itself. I wish I would have had a little bit better of a balance in going through medical school and my own personal life in terms of hobbies, but I did do it to some degree, and I urge you that if you're going to be watching this before going to graduate school, to definitely keep that in mind and to keep yourself happy and have time on the side to keep your own hobbies and personal life going. Now, that all being said, would I go into medical school again? The answer would have to be yes, because for me, at the end of the day, a small part of it was actual compensation, and yeah, I do have a lot of student debt, and I don't think that a lot of residents are really fairly compensated, because it really is difficult keeping afloat, having to stay on top of those loans, as well as living a normal life. It is an extremely rewarding field, and there's so much to learn and so much to do, and a lot of satisfaction that comes when you do have patients and when you do work with a care team that really cares and actually respects your decision. I think those kinds of sentiments are really hard to match in a lot of other fields, although I'm sure that every field has its own pros and cons, and this is just one of them. That being said, everybody's experience of going through a graduate school is going to be completely different. You may have some people who don't take out student loans, some people who have other things going on in a different geographical location, just so many variables that change your experience. And because of that, you should be taking my opinion with a grain of salt. As always, please like and subscribe for more videos. Comment and compliment below. Let me know how I'm doing so I can make some videos that are really tuned in to what you want to be talking about. I've got a few videos up here that you can start to watch. And as always, good luck.